What if I told you that the very technology designed to enhance our health is now a ticking time bomb? It sounds contradictory, but we're navigating a perilous landscape of optimization in public health that could lead to devastating consequences. Many remain blissfully unaware of the warning signs lurking beneath the surface. As technology advances, the flaws in these systems are becoming more pronounced, escalating the risks we face. Imagine entering a hospital, confident that AI is guiding every decision. But behind that facade of efficiency lays a web of biases and errors. The algorithms intended to improve health outcomes can actually deepen inequalities. It's a chilling reality. Consider a community dependent on data-driven health initiatives. What happens when AI reallocates resources based on trends that overlook vulnerable populations? This risk often goes unrecognized until it's too late. Now, picture yourself as a patient, trusting the advice you receive as if it's been meticulously crafted by advanced technology. But how often do you question the data behind those recommendations? Are the algorithms biased? Are they ignoring your unique circumstances? These optimization processes don't just manipulate data, they impact real lives. The consequences are not hypothetical, they're woven into our daily experiences, often unnoticed. Imagine a critical health initiative failing because AI misreads data trends. What if a community faces a health crisis due to an avoidable mistake? The fallout could be staggering, affecting entire neighborhoods. But there's a glimmer of hope. The conversation is shifting. Experts are demanding transparency and accountability in AI development, advocating for a deeper understanding of the systems that guide our health decisions. We cannot afford to trust optimization blindly. So, what can you do? Start asking questions. Engage in discussions about the technology shaping your health. Awareness is the first step to ensuring that AI serves everyone, not just a select few. As we confront these unsettling truths, remember our health isn't just data, it's about people. Let's hold the system accountable, demand clarity, and advocate for ethical advancements in AI. The future of our health is at stake, and it begins with recognizing the risks involved. Have you ever considered what lies beneath the shiny exterior of AI optimization in public health? Many assume it's all good news, but there are unsettling truths hidden just below the surface. Picture this: you walk into a hospital, confident that every decision is backed by cutting-edge technology. But what if that technology introduces unseen risks? It's not just about efficiency, we must also consider the unintended consequences that could affect us all. Now, let's look at Acity proudly launching a new AI-driven health initiative. Sounds impressive, right? Yet, as the data rolls in, a different story emerges. We might see an increase in misdiagnosis and an over-reliance on algorithms that overlook the human touch. This is merely a technical glitch, it's a heartbreaking reality. What if the systems meant to protect us are actually putting us at risk? Imagining a loved one in a waiting room, trusting a system that may not fully understand their unique needs. It's a chilling thought. As we dig deeper, patterns begin to emerge. Data-driven decisions can miss critical details. For instance, consider a community health program that prioritizes efficiency but ignores cultural context. This can lead to disengagement and erode trust. What happens when healthcare becomes just a numbers game? The effects can ripple through families, leaving confusion and fear in their wake. But before we let despair take over, let's pause. Recognizing these warning signs is our first step forward. Are healthcare providers truly listening to patient feedback? Are they critically evaluating the algorithms they rely on? It's not just about what the data shows, it's about the stories it misses. Imagine it being a patient who feels overlooked while the system prioritizes metrics over meaningful connections. As we wrap up this section, consider this: the true power of AI lies in our ability to navigate its complexities. By embracing its strengths and staying aware of its weaknesses, we can achieve better outcomes. So, the next time you hear about an exciting new optimization initiative, ask yourself, who are the hidden voices in this story? Understanding those voices could make all the difference. Do you really trust that the technology meant to protect us might actually be putting us at risk? That's the unsettling truth behind many public health initiatives today. We've been led to believe that AI optimization is a miracle solution for healthcare, designed to streamline processes, save lives, and boost efficiency. But what if this very technology could create unexpected problems? Imagine receiving a text that it's time for your vaccination, only to discover later that the algorithm misread your health data. That's alarming, right? The reality is, optimization isn't always accurate. As we lean more on these systems, we risk becoming overly dependent and neglecting the vital human touch essential in health care. Consider an AI system created to predict disease outbreaks. At first glance, it seems brilliant. But what if it overlooks a key demographic or misinterprets the data? An entire community could be left vulnerable. That's not just a minor mistake, it could be a ticking time bomb. You might think these scenarios are rare, but they are happening more often than you think. When organizations prioritize efficiency over accuracy, the consequences can ripple through entire populations. This is a situation unfolding right now. What's even more concerning is that many of us are unaware of these risks. As we embrace these innovations, we often forget to question whether they are genuinely beneficial. We assume the technology is flawless, but the truth is far more complex. Before you dismiss this as fear-mongering, consider the healthcare professionals raising alarms. They are noticing trends indicating that AI can't replace the nuanced understanding that comes from human judgment. From standardization